You need a chair now.
No, I think I'm good. I think I'm just going to be kind of a talk show host for this. Yeah. Hi, everybody. Welcome. My name is Tony Lucetto. I'm the chair of the Comparative History of Ideas Department, and welcome to the Humanities and Healing event. Before I invite our distinguished panelists to introduce themselves, I just want to welcome you all to this wonderful gathering. There are several of us here from the Comparative History of Ideas, which, as many of you know, is a program and a department in the humanities. And we are currently coming to you from the Life Science Building on the other side of campus. And it almost feels like we're in a different century. It just feels very, very different from our usual everyday kind of surroundings in a very good way. So we really appreciate the hospitality that our friends in biology have extended to us. I also want to acknowledge that, as always, we find ourselves on Coast Salish lands, and these land acknowledgements, while they have become customary and maybe even a little bit expected, they're very important for us at the university, and especially as we think about healing, because one of the things that is so important to understand about colonialism is that it's a disruption in right relationships among kin and often with our own selves. So really naming colonialism as a public health concern that continues is really a large part of the motivation for this event and for this conversation. The other motivation that we want to mention is a conversation that is, of course, going on, but we'd like it to be more robust between the life sciences and the humanities, because as you will see, as our panelists exemplify, that's a conversation that we really need to foreground, highlight, and invite others into. And that's the spirit for this particular conversation. Just by way of book recommendations, I don't want to make this into Reading Rainbow, but just by coincidence, I'm reading this fantastic book, which I would recommend to everybody. It's by Adam Schatz. It's called The Rebels Clinic, and it's a biography of Frantz Fanon. We'll save the lecture on why everyone should need Fanon for another day. But one of the remarkable things about this book, it's a story about how a psychiatrist from Martinique became a revolutionary. And one of the turning points in Fanon's life was a meeting with a Catalan psychiatrist named François Toquels, who had a radical idea that the mental ward, the psychiatric ward, should be a space of collective healing. Because what he found is that people would come in looking for help. They would meet the custodian and tell a story. They said, no, don't talk to me. I can't help you. Then they would speak to the receptionist, who would be a person they speak to, but they said, no, I'm not the expert. And then they would speak to the nurse. And then finally, they would have a minute with the doctor. And what Toquels remarked was that everybody, from the custodian to the receptionist to the nurse to the doctor, should all be part of this collective healing idea. That's an idea that really resonates with our approach to education and comparative history ideas, and I think you'll find that it resonates with our panelists as well. So welcome to this conversation. It's really a pleasure to welcome back some of our alums from the Comparative History of Ideas to be on this panel. I will ask them to introduce themselves in a second, but I also want to extend a thanks to all the folks who make that possible. Sibani Ram, who is not an alum of our institution, but when she was an undergraduate at Duke, began an initiative called HUMED, Humanities and Med Celebrations. And Sibani was the first person to bring this idea to us. And we're really kind of following in Sibani's footsteps. So she really was one of the motivating organizers of this event. I also want to thank the Department of Biology, who helped sponsor this event, the Simpson Center for the Humanities, the Comparative History of Ideas Department, and in the College of Arts and Sciences, Equity, Justice, and Inclusion Division. Thanks to Dean Maya Smith for her support. So lots of folks want this conversation to happen, and I will now try to get out of the way and let it happen. So I want to invite our panelists, starting with Dr. Preetma Kooner, just to say a word about who you are, what you do, and then we'll just go down the line. Dr. Kooner, CHID alum.
Hi, I'm Preetma. Like Tony mentioned, I graduated with a degree in CHID and micro from the University of Washington, and now I'm faculty at University of Washington Montlake. I do anesthesiology and acute pain medicine.
Our next alum.
Hi, my name is Marium Raza. I'm class of 2021. I studied biochemistry and CHID. I'm now a medical student over in Boston at Harvard Medical School, and I'm really glad to be back. Of course, I'm a third year.
Third year. Well, welcome back, Marium.
I'm Andrea Pardo. I am a CHID alum from 2006 and have been advising at the University of Washington since 2007, both in the biology department and the microbiology department.
I'm Janet Germeraad, Director of Academic Services, a CHID alum in progress. I've been at the university working in biology and working with a variety of students for 23 years.
We will count you as a chittle about
Okay, sure.
And she takes CHID class.
I do, whenever I
Yes.
get the chance.
Yes. I'm Cynthia Anderson. I am a CHID alum from 2006, and I have been advising in the Comparative History of Ideas program since then.
Fantastic. Well, what we're going to do is I'm going to start off with our distinguished visitors. Well, Preetma's not visiting that far away, but still visiting back, and Marium. And we're going to, I'd love just to ask you both a little bit about what the humanities added to your journey through education. What was it about the comparative history of ideas, thinking in a humanistic kind of way that you found valuable for your path as a physician, as a medical student? If you could just say a few words, please.
For me, CHID was absolutely the grounding factor, the saving thing that helped me understand why I cared about medicine. It gave me the language and the background to like think about people and health in a way that I didn't even realize is what I cared about. And so, I mean, I could not do what I do every day. I couldn't like get through the way I want to think about the world if I hadn't found CHID. And it was, I think it's something that I use day to day in my life in terms of just personally, but also it helped me navigate kind of the path you need to take to not just like achieve your goal if it's something in the healthcare, but understand why and what your strengths and what you add to the profession or to your patient's health really can be. So I think it looking back, it's like created the narrative of my adult life, and it certainly informed the way I practice medicine. So I almost can't explain how important CHID was for me.
Yeah, I want to echo a lot of your thoughts. And I think I didn't even fully realize it at the time when I was an undergrad, but I would say CHID was sort of the glue to all of my educational pursuits during undergrad, and it's become the foundation for my medical learning now as a medical student. I was trying to reflect on what is it that CHID taught me that I would like not otherwise gained, or why I find it so foundational. And I think it came down to two big things for me, and they're kind of interrelated. One, CHID taught me what it meant to be an interdisciplinary thinker. And I know that sometimes interdisciplinary is a little bit of a buzzword, but what that meant was when you go into a field like medicine, your job as a doctor is not necessarily just to prescribe medicine or to cure someone or to do a surgery. It's to take in all these different components of a person's life and understand how you can best serve them to begin that healing journey. And CHID gave me the foundation to be able to take in all the complex things that make up a person. And that kind of leads me to my second thing that I think CHID really taught me was it taught me to understand stories. Because at the end of the day, in medicine, as a physician, it's your job to learn your patient's story and sort of work in service of that. And I would say, my biology classes have been really important. My chemistry classes were important. Physics was important. None of these classes taught me how to understand a person's story in the same way that a lot of my CHID classes.
It's fantastic. I might actually just follow up on that question with both of you. Is there a moment that comes to you from your CHID or undergraduate education? Looking you up, Preetma, I saw that you were a participant in the Summer Institute in the Arts and Humanities years ago, which is such a wonderful program that CHID faculty and students have been involved in. I know you both did really interesting thesis projects. Is there something that you kind of hold on to from those moments that you felt was formative for you?
Yes. I remember it was spring quarter. I was walking through the quad. I just gotten out of one of Chandan Reddy's class.
Yeah.
And I feel so ashamed telling you all this because you already know it, but that's what I learned, that race was socially constructed. Like, I remember the moment. It changed my life. Like, the sun felt so good. And like, I felt like I could see everything. I was like, oh my gosh, like, how did I not know this? And I just like, I can't explain to you. I don't know if this is what it's like now in medical school, but like literally I would sit next to my co-residents in medical school. And I know physicians that think race is a biological category. And, you know, the fact that we are only now like coming to discuss this over at Health Sciences and like understand race as it's socially constructed with real implications on health, and it's 2024, is insane. And so I think that's why I connected with people who did CHID, and going forward, like, I just felt like that it was just one moment and like so many where I felt so privileged to learn something that I know has affected my patients' lives positively for having known it. And so, yeah, I think about that moment like probably once a week because it was so transformative to me, and it really has impacted the way I see how healthcare on an individual and societal level should be practiced. So I think that was the most important thing I ever learned.
It's amazing. Thank you. Marium?
Yeah, really, really powerful. I think for me, I would come back to there were CHID classes that taught me how to think about context and always question the context. And I think race is such a great example. For me, one of those examples was, I think, the way I thought about gender. In this class, that wasn't even technically a gender class. I took this CHID class on the history of witchcraft, which is super random. And, you know, I talked about this in my medical school interviews. People would ask me, like, what was your, like, most interesting class from undergrad or something? I was like, you know, I'm someone who loves history. That's why I was drawn to CHID. And everyone's heard the story of the Salem witch trials. I'd heard it before. And so I thought it was like, you know, kind of a cool class to take. But the way we deconstructed the concept of witchcraft and what it meant to women and the way different social aspects like religion, the society at the time, and then the gender dynamics, the way those all came together to create this like massive historical event that everyone's heard of. But I had never thought about it that way. I thought, you know, this is a crazy thing that happened in Massachusetts. But after this class, I thought, well, actually, quote unquote, crazy things happen when a lot of things coalesce. And there's always a broader context. And so in a similar way, thinking about the context like that now in medical school, when we learn things, for example, like how the OB/GYN exam is performed and history of that. I have it always in the back of my mind, like, let me actually understand the context of this, because it's not just that we do things in a certain way in medicine and that's how they're supposed to be done. There's a broader context that combines a lot of different things, all these things, race, gender, sexuality, history, religion, all these different things. And it's important to understand that context because, right, we will meet patients who have dealt with those contexts in different ways. And so, yeah, so kind of a like long story, but this witchcraft class really taught me, A, it was fun, but B, it taught me to question things. It taught me to look up the context of things. And that's been really important to my journey as a medical student.
That's fantastic. Thank you. Thank you both. One of the other goals of this conversation is to really help students who are thinking about medical school, thinking about a career in healthcare. How do they bring the humanities into this track, which often feels very rigid? So I would ask, maybe I'll start with you, Marium, this time. What advice you would have for people who are trying to figure out, they want to go, they have this North Star as healing, as healthcare, and they feel like there's only one trail through the forest. How do you make room for this humanistic education you were able to?
Yeah, I think that's a fantastic question. And I think that's where there is this like discrepancy between healing, which we often think of as an art, right? The art of medicine, the science of medicine combined. And then in medical education, it seems like it's a really rigid path. Like you take these pre-med requirements, you take the MCAT, you do all these really difficult things, and then you apply in a very convoluted system to medical school. And so I would say practically, CHID served a couple different roles for me. One, it was kind of a breath of fresh air on this campus. Science classes are hard, and especially at UW, they're huge, and it's not always very personal. And so sometimes, you know, taking a bunch of science classes in one quarter, it was like suffocating. So I needed CHID honestly as breathing room, as classes where I could sort of think about ideas intellectually, but not be on this really strict GPA curve. So in that way, I think like CHID or any humanities component is like practically important to like balance out your education. Otherwise, taking all science all the time is really difficult and it's very hard to be successful that way. And then I think the other thing is more and more medical school and the health science professions are very competitive. And in the way that you have to apply yourself to these programs and you kind of have to sell yourself and sell your narrative. I think that's very problematic. And I don't really like the way that we apply to medical school and the way we have to do it, but it's kind of the system we exist in. And so I think the other reason having a humanities component was like practically important to me was it helped me explain myself a lot better. Like it helped me explain my story. It helped me explain that actually I don't want to just be a doctor because I want to learn the pharmacological structures of medicines and then prescribe that to people. I want to be a doctor because I want to learn from people. And, I learned from people in my humanities classes, right? Such as like, a philosophy film class I took through CHID or, so I think that's like the dual like practical purposes I would say was, like it's really hard on your GPA and your mental health to take all science all the time. So exploring the humanities is a great way to explore ideas in a different way and sometimes a less stressful way. And then I think it helps you explain yourself to medical schools, which is ultimately what you have to do when you apply.
I completely agree that, yeah. So I think just for your well-being and like balance, I think we need humanities in higher education. And so it's also a good strategy to help make you appear well-rounded, help your GPA, certainly help my GPA being a CHID major to balance out some of those more, not difficult, but some of those more graded on a curve science classes. And then it really helps with networking, which is so annoying and a frustrating part of, I think, every step of this process. But like you mentioned the Summer Institute, I got opportunities to do things because of the CHID program, which introduced me to people and other programs, which I got to kind of use to portray myself as somebody who would be someone they want to take a chance on to go to medical school. And now as someone who I have been on a couple of committees for both residency programs and medical school, when we're looking at people's CVs, everyone is going to be working in a lab or like helping with a science research project, but we do stop and pause when someone's doing something that seems like it's, outside of this potential scope of medicine, but they're passionate about and they're interested in. So I think that CHID allowed me to meet people and have these opportunities which I wouldn't have otherwise if I had just been like narrowly focused on just fulfilling all the prereqs to be pre-med. It's absolutely a struggle though, balancing all of that. So I highly recommend talking with your advisors really early, because I think there is a way to fit in CHID with the prereqs you need to take and graduate in an appropriate amount of time. But you do have to be kind of forward thinking about it. But I feel like everyone helped me so much in both of my departments to like make it happen.
That is a beautiful segue, Preetma, because we definitely want to take advantage of the presence of three wonderful advisors to kind of give us that really concrete advice. Greg, maybe could I start with you? What advice would you have for students who are just in the thick of it right now?
Yeah, I mean, the amount of times that I've said, like, you don't have to have a BS or a science degree to go to medical school. Like, I've said that millions of times since, in my advising career.
Maybe make a t-shirt.
Yeah, exactly. Like just like pull down the sign. I don't know. Because and a lot, it's usually met with, so students are kind of only seeing the one path, and that makes sense. But I think especially at a place like UW or institutions that have so many opportunities, majors, programs, like there's a really good way to marry these things together. So like I have sent so many students over the years that were struggling under that burden of like all science all the time, like all their 15 credits was just physics, chemistry, biology, and they're just suffocating in it. I've sent them to Cynthia and moved people's paths and helped direct them to, hey, you can explore what you want to explore. Like these things actually aren't different. They're very much on the same track because you're thinking about the people. I mean, you can't be a physician without the people. So it's like learning those people skills and just that ability to understand stories in different contexts is an amazing sort of result of getting one of these arts or humanities degrees, because that's going to come naturally. And those prereqs are there. They support what you need for the next step. But they're not the only thing, you know.
Janet, what would you add to that?
Oh my gosh, daily. I have to do biology because it's the best major for pre-med. No, it's not. Like it's only that if that's what you love, right? And you know, I want a whole major full of people that are just doing it because they think it's a checklist and it's the best thing for this other goal. And I will often, so Cynthia always sends me the list of like, hey, here's CHID stuff that's available. And I send that out to students and to specific students. I talk to them about it all the time because, for lack of a better word, the magic of the CHID program in particular is that it forces this self-actualization, but also for you to articulate that. Those are two very separate things. And I don't think students realize that. And as you articulate who you are being forced to stay grounded in that. And so I think it really teaches you about your own individuality and gives you the confidence and the practice to speak that. And I said at the beginning that I was, you know, a CHID major in progress. When I took courses in CHID over the pandemic, those courses are part of what drives how I try to change the biology curriculum now, because on the first day in a 100-level class, it might have been 200 level with Dr. Maria Elena Garcia, and it was the end of nature in a time of love and loss. And Cynthia sent that to me, and I didn't send it to the students. I was like, can I take this class? Like, I need to take this. I read the description, and I'm like, I need this to inform me because my students are struggling in biology. We don't teach you these kinds of articulation, and you really need them, not only for yourself, but to go out into the world and make the impact. And, you know, so many students will sit across from me and just say, oh, well, I want to help people. It's got to be more than that. That is a great, but how? And they cannot answer. And that's not going to get them through a med school interview. And it's not going to get them through the long haul. I think you guys could do the difficult things, the science, because at the same time you are feeding who you are and understanding who you are without, oh, I got to change and I got to fit the mold, right? Like that's part of that breakdown of those societal structures is I'm going to stand in this as I am because that's enough and that's important to the whole conversation.
Cynthia.
Yeah. A lot of the same. I'm going to even take it from the humanities side as well. And students, maybe the confident. And also, thank you for being here. I know we've got folks online. Thank you for being here in person too, and coming over to spend some time with us. You know, from the humanities perspective too, oftentimes students will feel that I have this pull. I want to help people and I've articulated the kind of help I want to do, but I'm really intimidated to like go and talk to a biology advisor, to go talk to a microbiology advisor, to take that first class, or even I'm doing poorly in that class. Does that mean I can't go on to medical school? It does, you know, the language that's used around like humanities and health sciences and even just kind of this like healing and humanities, I think is so important. And I think for students that have a lot of confidence in the humanities or maybe have had a lot of work thinking about gender or thinking about race, but how does that play into medicine is connecting with faculty and other med students that absolutely know how to talk about it in that way. And I use this in my work every day, and hearing that is so important isn't even the biggest word we could use. The fact that people's health and their healing and their stories can be a part of the conversations that they have with doctors. And I'm 46 years old, and I had a friend come to me and say the first time she met with a doctor recently, and that doctor just gave so much time and the things going on in her life the doctor cried and said, you're going through so much. And it was this first time that she had this doctor in her entire life think about her full self in the healing, whatever the healing process was going to be. And I'm not saying that's just in the humanities, but that is like making someone that real person. And I think the kind of advising that I do in CHID and in the humanities really is around helping to build that confidence for a student to say, I care about other people in the world and I want to do it in a medical space. And I don't know if there's room for me to do that because I'm so centered in the humanities, or all I've done is this kind of work in the humanities. So it's really like that kind of building up a lot of that confidence for humanities students too, to take those classes and to go and see Janet and Andrea and like, your contributions are important in all of these conversations and all of these different classes. So there's one example I want to say. There was this CHID student during the pandemic that was up at CHOP in Chaz, and he had military background. He was a CHID student. He had military background, so he was doing a lot of medic care for folks and that kind of like first kind of medic care. And then he came to UW and he's like, I can study medicine because he had come into UW and been a CHID student. But he had this really big pull to study medicine. And he had this example of the community work he had done and then went into nursing and CHID, and that very like, I can do this and I have confidence in it is a lot of the work that I do.
Hey, Cynthia, that was beautiful. Love to open it up for a broader conversation. And there's folks here in the room, there's folks who are joining us on Zoom. And also maybe folks on the panel would like to ask each other conversations. That would be great as well. So does anyone have a question or a comment that they would like to verbalize? I'm going to look first at Zoom, see if anybody's there. Feel free to raise your hand, or anybody here in the room would like to say a word.
Yeah.
Who's got a couple? So we'll go in the back and then we'll go to Luke. I'm sorry, what's your name? Eliza, please, Eliza. So the question, I'll repeat it for the folks in Zoom. The question is, did Preetma and Marium's thesis in CHID have anything to do with medicine?
Yeah, it did. So my thesis was on refugee populations in Seattle and their interactions with the healthcare system. I think I specifically looked at a program that had been developed centering around refugee women giving birth. And this program in South Seattle helped women work with doulas rather than like traditional like hospitals and going through that system, and sort of trying to balance some of their community practices and with the new environment that they were in, the new community they were in. So I kind of, what I did was I interviewed, I think 10 or 11 of the women who had participated in this program, and sort of coded those interviews and thought about how their interaction with the healthcare system was improved by having this community-centered program. And so that's sort of a summary of what my thesis was. But yeah, I was always someone who was interested in healing in medicine. And I, just for context, I think I had already applied to medical school by the time I wrote my thesis. So that was like something I knew I wanted to combine my interest in medicine with things I'd learned in CHID and populations I cared about in this community.
Mine was called HIV and the Contagion of Liberal Intimacy. So I knew I liked studying about viruses. That's why I did micro, but I realized I liked learning about it in more the cultural, societal ramifications of like how certain viruses mark people and identities. And so it gave me the opportunity to, not do like statistical data. Like, honestly, I don't really like to do that kind of research. And I got to really deep dive into kind of like the historical and cultural context of how HIV emerged, and the looking at the AIDS epidemic from like a public health and culture perspective. So I don't do any kind of work in infectious disease now, but I think the way even my thesis really helped me out is, again, it gave me something to talk about during interviews and in essays in my application, to show kind of, to me, the big theme I wanted to tease out was like the intersection between science and humanities literally is people. We're practicing science on people's bodies. And so I felt by doing the thesis, for me, it was a culmination of like why I want to be a physician. And I think it really helped me kind of hone kind of my pitch, I guess, as to why I could navigate being a physician. And so I found it was really, I just felt lucky to have the space to like do that work as an undergrad, because it like, most people don't really get to spend the time doing that. So it was a really great experience.
Great. Thank you for that question. That was great. Luke, you had a question.
Yeah, you kind of answered it. I guess I was just curious if you have more examples of like how those interviews went and like how because like I think I've always been on board with like I see the value in shit as like a sort of self-development and for viewing the world, but I've always been a little skeptical of how to like apply it for a career basis, and like it's not any judgment of the department or the staff at all. It's just
No offense taken, Luke.
just from my own like practical reasons, right? And so I'm just curious how you like get more details on how you were able to do that. Like what pushback did you get? Like, did you feel disrespect? How did you handle that? Like, obviously I know there's a lot of factors that play there, who you are, yada. But I'm just curious.
I'm just going to summarize the question for folks who are online. That's a great question, Luke. So Luke was basically expressing that it would be understandable to have some skepticism about whether humanities education is actually relevant to real world questions and people and issues. And so Luke was inviting our panelists to offer any more examples of how we can think about the relevance of CHID or humanities or.
So not quite. What I'm asking is not that the relevance in terms of real life situation is how to pitch this.
How to pitch it. Oh, that's great. Okay. So how to represent it. Oh, got it. Okay. Thank you.
Legible to admissions.
Oh, okay. Great. Thank you for the correction. How to make this.
Because the value is there and
how to make it legible. Okay. Thanks, Luke.
Yeah.
Appreciate that clarification.
Well, you're closer to the process.
Yeah. How do we make it legible, Marianne?
I mean, and I think it's a great question because CHID like doesn't exist at other universities. So when people read on your application or your resume or whatever, you studied, what is this? Yeah.
That's never happened before. Yeah.
I got a CHID water bottle for graduation and I like have it. And all my other friends and my people are like, why does it say CHID on your water? Like, what is that? And so I think it can be sometimes intimidating to have a major no one has heard of, but I would try to reframe it as actually an opportunity because it's an automatic conversation starter. Like people don't know what it is, so they ask, and they can ask it in a hostile way, like, why would you study this? More people are genuinely curious, like, what is this? And I think in terms of, you asked a really good question about how to pitch it. And this is something that our advisors are really good to practice with. But I think for myself, I would pitch it as CHID taught me to think about why. Kind of some of the things I said earlier in this panel, but it taught me how to understand people's stories, how to take in like different kinds of contexts. And what I would kind of combine it with was then in my shadowing experiences, when I would work with physicians and see what their job was actually like, it wouldn't be like a biology class. Like it would be talking to people and hearing what's going on in their life and what they need help with, and what in college helped me combine all those things, analyze those things, and be able to like have, productive solution or move forwards. That was CHID. And so I think you asked a really great question. And I will also just like rep the advisors one more time. Like even my parents were like, what is CHID? Like, why are you adding that on? Like, why don't, if you like humanities, do like English or something that we've all heard of. But I think really viewing it as an opportunity. And I think almost every medical school interviewer asked me about it. And I think it's also good because like the whole point of any interview or application is you're kind of selling yourself and your story and what makes you unique. So like, this is one of the things that makes you unique. You went out and studied something because you're that kind of person who wants to understand the why and understand the context. So yeah. So, but it's certainly intimidating, and it's certainly something to practice with advisors, with family and friends.
Yeah, exactly the same. I think you'll always get the opportunity to talk about it because people won't know what it is. And that at that point, I think you just hook them on explaining what you learned and how you are able to apply that to whatever your focused on in that, pursuit. So I didn't get into medical school for, I think I applied twice before I got in. And so in between, I worked as a research assistant. And even then, I was able to like show that I can synthesize information, that I think about people, that I'm able, how my communication skills were enhanced by CHID opportunities and things like that. So I think whether it's a workplace or applying to different types of graduate school is just kind of focus on this specific experiences you had because of CHID, whether it's study abroad or you got to do a symposium or, even like a aha moment you had in a class, and just, they're going to ask because they don't know what it is. And that's where you can really like kind of brag about it, honestly. And now, as being someone who has interviewed people for medical school and residency programs, like honestly, like I said, like you take like a millisecond to look at a resume. It's like the 100th one you've looked at that day. Something jumps out. I just want to have a cool conversation with somebody for 15 minutes. And so I'll be like, what is that? And if they're able to tell me about like a CHID study abroad, like that is so interesting. And then they get to know you as a person. And you do have to be purposeful. Like this is the information you drop during that interesting story you told about CHID abroad. Make it about healing or intersectionality or medicine, like the topics you learn that apply to what they want to know about you. But I think CHID gives you like infinite ways to like get that in. So you do have to practice though. So yes, again, I highly advise getting practice with people that understand CHID. And something I wish I had kind of done is maybe at the end of each class or something, like reflect on a couple of points that if you were, let's say, to have to go to an interview, what you would bring up, and then review those before you either start writing your personal statement or go to interviews, because there's little things like that really stick with interviewers, that you're passionate about something, that you think deeply, like that's what they want to know, because that's what you're going to have to do as a healthcare provider.
Sure, thank you. Those are both great answers. Really appreciate it.
Yeah, those are. I wonder if the advisors would like to add anything to those
Yeah,
great answers.
I only have a CHID degree, and so everybody like, what? And what are you going to do with that? So my thesis project was on access to higher education, barriers that prevented it, race, class, gender, all the things. And so it makes sense that I wanted to do this work in higher ed and advising. So I think, me and Cynthia and Preetma and Marium all have the same degree, but it's literally completely different. So I think just talking about it is an opportunity. It's a unique conversation starter, and you can make it work for you. So when somebody sees, English or, a language major or something else in arts and humanities, they think, oh, I already know what that is. But the fact that they don't know what CHID is and it requires some explanation just literally makes it stand out. And it's always going to be the conversation starter, and you can mold that conversation how you want it to be.
As we often talk about as advisors, students' transferable skills, and CHID gives you a lot of those maybe softer skills. It's not like, oh, I can do data analysis using this program, but you might learn that in CHID, but it's not. It's more the ability to communicate. So when you're looking at just oh, I'm going to get a job right after I graduate, like looking at the job description, even coming back and sitting down with advisors, going, okay, help me identify my transferable skills. Because even in biology, a lot of times it's like, well, I don't have anything to put down. I'm like, oh my God, you did 3 labs and you did there's all of these things. And they didn't even see that. So we can really help with that. Also, the Center for Career Services, you can use those services for up to 2 years after you graduate. Oh, maybe I think they added 1 more year free. So they can help you test out that job. Okay, here's what they're really looking for. You're applying in this industry. Be sure you have these keywords. And then how do you attach that skill you learned in CHID to that?
Yeah, I'm thinking about that I had an alumni come one time. They were at City University in New York. Is that right? Yeah, and they had been applying for this lab, and the one question, it had nothing to do with all the work they had done to get into this lab, was like, tell me about comparative history of ideas. Tell me about CHID. And I think probably you would want to work in labs where somebody was interested in that. That doesn't mean everyone's going to ask it, like you said, like some people aren't going to be as like, here, come here, tell me a little bit more about the humanities focus that you did, but wouldn't you want to work in spaces where folks wanted your contributions in the conversation? And you get to decide a little bit too, right? And as you're applying to places, like, I felt good about this environment, or I felt like I could, take these conversations that I've had and continue to have them. So I think about that a lot. I think about her, and that's how she got that lab. She's like, I know I got it because I was talking about what I did in CHIT. It was Amanda last night. And then the other thing, it's kind of on the top right time a minute ago. It was probably connected, and I'll think of it in a moment. But I'm going to say what Janet said to the Career Center. If you haven't accessed it, they have these, so you want to go to grad school, so you want to go to medical school, so you want to be a lawyer, these really great kind of conversation starters where there's a lot online that you can access with that. And it's grad students, it's med students, it's folks that are in that space or have been in it recently. And it's kind of a nice way to think through those questions. And then you can also then talk with a career counselor, but it's nice to see how other folks are talking about what they're doing and how they did it and how to prepare for those interviews, or when you're coming out of it, maybe at interdisciplinary focuses. Yeah. So I would just say that. Yeah.
I mean, a lot of employers were asking about, like, they're asking you to write a diversity statement and things like that. And so they might make an assessment by how you look, but that ability to articulate diversity, equity, inclusion based on what you've learned, that's really powerful. That's really powerful. Someone's like, okay, we need that person because this is their perspective. And they're not even looking at their primary set of qualifications that they wanted, because that energy is there to take them forward to make them better.
That's actually a super good point. More and more in the medical school, and I know in our residency programs, is, we are asking people to include a DEI statement. And if you're able to say, like, anything you did in CHID is already doing work in that space, and you are just like years ahead of other people. I mean, people who have been physicians for years, because you'll be able to state it, you'll be able to name drop Foucault, Fanon, like that's, you're probably you get volunteer opportunities or like work with people in your classes to work in this space. And so I think that is a huge, unique opportunity that it didn't really exist when I was applying, but now, that's like right there is the reason to do CHID.
Yeah.
Right.
Yes.
I see Nick Barr. Before I go, Nick, I just want to say, in the middle of this CHID Love Fest, we're only on day 2 of the quarter. We still have room in our CHID courses. If anyone's thinking about it, take a look at the time schedule. We'd love to have you. There's room in Philip Thurtle's Bios Futures class. I'm teaching a course on the humanitarian crisis on the border. We have 2 wonderful fellows who are teaching about subconscious and dreaming and technology. So check us out. We've got plenty of things. Yeah, please come on. You should come aboard. Nick, please.
Thanks for putting that pitch in there. Thanks so much for the talk. I'm sorry, I came a little bit late. I'm just wondering, sort of following up on the last discussion, Dr. Preetma said about not getting in the first time, 2 times.
Yeah.
Fine. Then you worked as a lab researcher.
I worked at for a clinical research. Yeah.
I guess I'm just curious, maybe for everybody too, because I remember as an undergrad, I had a very limited set of ideas about what I would do next. And I ended up going straight into grad school for humanities, which in retrospect, I don't think is a big idea. And now when people talk to me, I try and get them to think a little bit more widely about, like, what else could you do that might be sort of a bridge experience? Like, you could do a Fulbright teaching English, so you get actually paid to travel, right? Which you're not going to be able to do very easily later. So I'm just sort of curious if there are things that undergrads might be thinking about that might be beyond just applying straight to that.
So I'm going to actually ask, I see a few folks on Zoom, if we could just take maybe a couple of questions for the panel. So is that all right? If I just, so we have Nick's question about what are the ways we can kind of bridge undergrad with graduate school with some other things in the middle. I see Ishita and Louisa McKenzie. You guys want to just say your questions and we'll get to the panel? Go ahead. Ishita? We can't, I think you're, yeah.
Okay, hi. So I had a question about you guys mentioned your thesis, Drea. You mentioned how your thesis was focused on barriers to higher education, which kind of foreshadowed the route you took with your career. Our wonderful doctors talked about how your theses were like focused on medicine. I had a personal question. So something that I have been focusing on in CHID, like, or with my thesis, really has very little to do with medicine outright. And so I was wondering, is it still okay to pursue something that outright doesn't have that sort of connection to where I want to go in the future? So I do want to go to medical school, but my thesis or stuff that I focused on in CHID kind of has very little to explicitly connect it to that path.
Thank you. Louisa, can we add your question?
Thanks. So in true academic style, I have more of a comment than a question. So what I'll do is I'll drop it in the chat, and I do have to drop off at 1 o'clock. So thank you so much. I'll listen until then.
Okay, thank you, Louisa. So I'll turn to the panel. So we have Nick's question about what activities after undergraduate, and Ishita's more specific question about, I have a thesis that's not about medicine. Is that a problem?
Yeah, and I actually think the two questions are related in a way. I personally think it's like not a problem at all to have a thesis that's not related to medicine. And in kind of similar fashion, I think it's not a problem at all to do a gap year or a couple of gap years that are maybe totally unrelated to like what you actually want to pursue, whether it's graduate school or whether it's a career in a specific field. I think some of the themes from our conversation that I'm coming back to is it's all about thinking about why you're interested in those things and what you want to gain from the experience, whether it's writing a thesis or doing a gap year experience, and how those things are going to inform your future career. So, with my thesis, it might be a little bit easy, like not a lot of mental gymnastics to talk about, okay, this is why this led me into medicine. And very similarly, I have lots of friends who took gap years, maybe doing medical research or like working at a health tech startup or something like that, where it's also, perhaps not a lot of mental gymnastics. But I also have friends in my class who did things you would like never expect and end up in medical school. And I keep coming back to medical school just because that's my background, but I'm sure the same applies to like law school and all these different career paths. But, I have lots of friends who did a Fulbright or did a Rhodes Scholar program. I have friends who worked in finance and consulting in these fields where they actually realized that those fields just pushed them more into wanting to work with people and wanting to heal because they left those experiences pretty jaded. People travel even outside of a Fulbright, work in a different country, like people do all sorts of things. And I will say, so for the gap year question, I'm not someone who took a gap year. Part of the reason probably was I graduated during the pandemic and I didn't have like a clear idea of what I would do for a gap year. So I just sort of applied. But now that I've met all these people and heard all these different experiences, I actually, if I would go back in time and if it wasn't the pandemic and like I could travel and things like that, I would seriously consider it. And one of the ways I think CHID is helpful is because in most of my CHID classes, like I met people who did not want to go to medical school. Like they were folks studying all varieties of things, wanting to do different things, working for nonprofits or like different aspects of working in the Seattle community. And so I actually think like I could have probably learned or like figured out a gap year opportunity just from talking to other people in my CHID classes, or of course applying to these like well-known programs. And so I basically highly encourage it. And I don't think it has to be medical focused. You just have to be able to talk about it and make the connection sort of later. And that's the same thing for your thesis. I would say, if it's something you're passionate about, that's like what's going to shine through when you start talking about it. That's what people are going to listen for. They're going to see a student who's bright, motivated, passionate, articulate, and like those are the qualities, and you can speak to this more, but I think those qualities interviewers really look for more so than like, oh, like I did this thesis because I want to do medical school. That's it, you know? Yeah. I think taking time between undergraduate and graduate school is like a great idea. I did it because I didn't get in, and you know, at the time it was devastating, but looking back now, having real life, real world experience just working is really important. Because at the end of the day, I mean, what we all do is labor. Like my labor is doing anesthesia, but like it is a job. I have to work with people, you know, and when I meet someone applying for medical school or residency, I think, do I want to be in the middle of the night with them working on an emergency case? Right. And I've met like former engineers, former people in finance, people who had to go back home and take care of a ill family member, all these people who didn't find medicine like right after undergrad. And all these experiences are just going to make you a better physician or a lawyer or a nurse practitioner or whatever. And so I don't think, if that's not in your life plan, I think it's okay. I appreciate now in graduate education, we recognize there's a certain privilege to people who are like, oh, I volunteered for a year. Like, that's not real, you know? But I find more now with the interview process is we are acknowledging that people applying to medical school, like if you had to go and get a 9-to-5 job to pay off your school debt, like that means so much more than, oh, I went to try to like save some people in some country. So, you know, like medical tourism isn't like, we don't look at it the way we used to. I think most people now in the application process. And so if you need to go and get some stuff done between undergrad and grad, if that's a strength in your application, you didn't get in or you just can't fit it in right now, like absolutely don't think it's going to, I think it's going to make you a better candidate. So don't worry about having to take time in between. And then definitely, yeah, I agree. You should write your thesis on what you're passionate about. If you're worried about how to kind of like pitch that, I mean, you're always going to get asked like, name a challenge or like, what was the hardest thing you did in undergrad or, you know, and then you can say, well, like I wrote a thesis and you can talk about it. And it doesn't have to be about medicine. People just want to know about the experiences you've had. So you can always find a way to talk about it, but don't force yourself to do something you're not interested in, because like that is miserable and you won't be able to like express it in a thoughtful way, which is really just what you need to be able to do during your personal statement or your interview.
Any more questions from the room? Yes, in the back.
Are there any insights from any of your undergrad education that influence your experience in healthcare today, working in that field?
So the question was about any insights from undergrad that influence medical work right now.
Yeah, is it shape your experience in that?
Yeah, every day. I think specifically for what I learned from CHID is like we talked about context, understanding the history of our society, the impacts of colonialism, white supremacy. Yeah, like I mean, it's just
race and social construct.
Race and social construct. You know, it's like we kill our Black patients. Like I say this to my residents, we're killing them by the way, like mortality in this country is around childbirth. And it's like unacceptable. But even to think about that, like you have to have context and understanding about our culture and our history. And like, that's what I don't think people in medical school, they just don't teach you that.
Medical curriculum, right?
Yeah.
Gap in that.
Yeah. And so I think the way I look at what I want for my patients is like, yeah, every day has been impacted by CHID. And I think y'all will be in a unique opportunity that now finally like people in my generation who are making these decisions, who gets in, are listening to that. So you can talk about this to them. And I think you can kind of just be like, look, I've been thinking about this for years. Like, where have you been? Because that's like how I feel, right? Like I just like miss my CHID friends. It's like people in med school like think race is real. Like I'm like, how? And I like, you know, you can't explain it when you're not Yeah. Like around people who have like that shared context. And so like, yeah, don't even worry. Every day you will use the stuff you learn in CHID.
Yeah, I'll just echo that. I think the phrase social determinants of health is like a big buzzword right now, and sometimes it's an empty phrase, but sometimes I think, I don't know, I've certainly talked to people where they'll just like throw that in and it doesn't like mean much for their practice or the way they take care of people. But I think CHID taught me what quote unquote social determinants of health actually means. And it's a lot of what you've spoken on very eloquently. It's a lot of practical things, like I was working with a hand surgeon and two of his patients had injured their hands pretty severely on the job. And their main problem, they had pain and they needed a surgery, but their main question was like, how's my workers' comp paperwork going to get filled out? Like, I, need to support my family and those kinds of questions, like that kind of context, like being able to, as a medical student, be like, when you think about the differential diagnosis, being able to say, hey, like, I know this isn't in the textbook, but I think like one really big thing we should think about with this patient is like how we're going to figure out their workers' comp paperwork. It's something I gained from CHID. Like I didn't gain that from any other groups. And then just briefly on a more meta level, I think my undergrad experience taught me a lot about resilience and balance and making time for what you're passionate about, even when you feel like you have a lot of different obligations, like a lot of different prereqs. And I think like those are sort of like more life skills that are very important in medical school, which is difficult. And at times like, right, like you're totally right. Like during my clinical year, we had like 24-hour shifts in the emergency room. Like they kind of suck. Like it's hard to be awake for that long and to try to take care of people in those experiences. And I'm sure I'm going to have more of that in residency as well. But learning to really be certain of what I cared about, what I was passionate about, think about those things through CHID, like still grounds me today. So even when I have a shift like that in medical school, I'm like, this is actually a privilege to be able to take care of people in this way. I'm really tired, but I'm just gonna think about that. And so yeah, so sort of on a meta level, undergrad is like, it taught me a lot.
That's great. I think maybe by way of wrapping up, I might just ask everyone on the panel, starting with our advisors, if there's one thought or encouragement or suggestion you might want to leave students with as they're thinking about what to do as they go forward. So Cynthia, do you want to start us off?
Absolutely. And I remembered what I was going to say. So it's a great thing to end with too. And it goes along with undergrad too, completely, is when you do find all the time, you have students, I'm really interested in this, I'm excited about this, I'm passionate, all the different language we would use for that. But there's also so much room to be able to be open to asking questions about things. And I'd be interested, I'm sure, as you're reading applications, as you're applying to grad school, like being open to saying, and this is an interesting thing for me that I want to explore. So I feel like sometimes students want to say, I have an answer to all of these things when I'm applying to something, and how do I best articulate, how I know what I know, but there's also just so much value in leaving that room for, and I also want to know more, and I want to know how this plays out in the healthcare system, because I read an article where this doctor, Preetma, said, we're killing Black people in medicine. That is so interesting to me. And I want to know more about how that is the historical, decisions that have been made that make our healthcare system that is continuing this practice that people are aware of and we're not, so that's a way to leave those questions open. And I think that's a conversation I have a lot with students, because it's a vulnerable place to be when you're applying to things that maybe are so competitive and have in your head, you think I have to be a certain way. And so the value for me in coming out of the humanities and definitely coming out of CHID is students staying open to having room to ask questions and confidently ask questions. So I confidently want to know more about this because either I've experienced it or I'm interested or I'm passionate, or it's just something that I want to be a part of the change for it. And that definitely goes along with like that. I'm passionate or I'm excited about these things. And I think translates really well to medicine. So many students on this campus are involved in social justice work, community work. They're trying to translate what they learn in the classroom into their own environments and their communities and their families. And the more we can leave that nuance, I think there's a lot of value in it. And I don't know if that translates into medical school applications when you see a student have that.
Yeah.
But that would be how I advise it.
Jen?
My heart is so full right now because this is the work I've been doing for 23 years, like the conversation that's happening here. And for those of you interested in healthcare or thinking about that, the world of healthcare and the kinds of things you can do is so much bigger now than it was 23 years ago. So when that might happen that you don't get into dental school or med school or pharmacy school and you got to take a step back, that is okay. Be okay with that. Did you notice how just smoothly Preetma said that? It was a devastating thing for her. She didn't get in the first time, but here she is now. It's the best thing ever. Like, it's made me part of who I am. And that's the attitude that you have to have. A lot of students that after undergrad, they're like, I didn't have the opportunity to work so much that I didn't get to volunteer. I didn't get to do these things. Okay, great. Go get a job at Starbucks. Why Starbucks? Lots of hours, so that you have hours in the day to go volunteer and do things. And they also have a whole benefit package of additional free education that so take some business classes or whatever in that interim, whatever it is to cultivate yourself. It's not about the job. It's what you're doing with your whole life and your time. And that is really, really important. So don't be afraid to just take that time and let your education gel. Several of the students, there's actually been a couple over time that came back to say, yeah, I did the whole Starbucks thing and I got to be a community educator at a CMAR clinic because of my language skills. And ultimately, we're like, now I need help. I want to be a hospital administrator. That's how I want to work and interact with people, to get at the things you were talking about, like how do you fill out the workers' comp? Like, that is a limitation to access. And that's where they wanted to create equity and diversity. So there's all these hidden things. You stand back, when you walk in the doors of any hospital, there are thousands of jobs happening there. So just keep that in mind, like the universe has got you. And so sometimes you just have to be able to listen to that to get to the right place.
Andrea?
And talking to students, I've said a lot, like, we know how to do school, like you've been pushing through since 5 years old, and I think, there are definitely some people who are like, this is just where I'm at, and a gap year or taking time off isn't necessarily their path. That's okay. But I think for the majority of people, they are so served by taking that time out of school, because it's like, you've been in school since you're 21, 22, and then you jump right into a healthcare program or some kind of graduate program without any in between. I think that transition post that program might be kind of rough for some people, because it's like, oh, well, there's no guiding curriculum. What do I do with my life? The end goal. So we know you know how to do school. What else can you do? How do you apply it? What are the things you've learned along the way that real life provides you? That, crappy job working as a cashier, or like whatever job it is, but look how many people you've interacted with. Look how you know how to disarm someone who's having a bad day. Look how you can talk to somebody who is completely different from you, or maybe doesn't even have the same language skill as you. How do you communicate that? Those experiences come from that just real world. And I think students sometimes feel that immediacy and urgency to but I'm doing all this, this 4 years of school is for this purpose. And it's like, yes, but we know that you know how to do school. How do you translate that? How do you make that part of who you are in the context of living, and not just in a program of school?
Okay.
Yeah, I think, thank you guys so much for all of your thoughts. It's always inspirational to hear from you guys. I think my closing thought for the panel and for all of you guys is also just to continue having hope. When you're in the thick of it and in undergrad, whether you're pre-med or pre-whatever, you're taking all these classes, you're doing all these things, And sometimes it can feel like a slog, and it can feel like there's a lot of uncertainty in the future about what's going to happen after college, and are things going to work out or not work out. And I think like listening to all of you guys today, like, and just reflecting on my own experience, I wish I would have just been more hopeful. And I don't know if you can like go back and do that when you're like really anxious as an undergrad, but by giving it your all and being an engaged thinker, I think, you know, I am now optimistic that you do end up reaping some rewards from that. And whether you face setbacks, everyone faces setbacks. Just by virtue of going to school here, you're strong enough to get over them. It's, you know, this is a great institution. It's at time a challenging institution. And I would just say have hope. Like, being blunt, I didn't know anyone who went to Harvard ever. And like, I applied and I like didn't think I was going to get in, and then I did. And that's like, so now it's like maybe easy for me to say, oh yeah, things work out, like, you know, but like, you know, it was really tough going to school here. I didn't think I was gonna, you know, I didn't know if I was gonna make it anywhere. So just be hopeful, be engaged, do your best, do what you're passionate about, and things end up falling into place.
Yeah, we recognize that uncertainty is so anxiety provoking. So that's okay. But if you're uncertain about whether you should do CHID and apply to medicine, you can leave that one behind. That's like my, like, I don't remember what I learned in Chem 142. Okay? I remember what I learned in CHID. So if you were like kind of wondering how to fit it all in, like my closing thought is we can figure it out. You can do it, and it's actually going to make you better at healthcare. So I hope like at least that has gone through.
Fantastic. With Janet, my heart is also full, so I love how you put that. This has been a wonderful conversation. I want to thank all of the panelists for just such eloquence, such generosity. This has been a really wonderful conversation. Thank you all here in the room for joining us today. I know it's early in the quarter, but I always like the beginning of the quarter because I feel like I'm not behind yet. That's more true. That's more true for students than for faculty. I'm already way behind. And also thanks for folks on Zoom and for folks on the recording who will see this in the future. Hello, future. Thank you all. I think we're going to close now, but please join me in welcoming our terrific panelists. One more word of thanks. I want to thank Sophia Choto and Martha Dina Russell for helping us set up this event. Thanks for all the backstage work. And we have about maybe 20 more minutes or so in this room. So if folks want to grab some snacks, chat informally with our panelists, please do so. Thanks very much. Bye.
I'm sitting over here. Look, I
Send me the recording and I can